and I'm one of the emergency medicine consultants at Hastings.
Great. Now, tell us about a good decision you've made in your life.
So, good decision made in my life was to definitely do emergency medicine and to come to Hastings. So, I was a medical student here and I was an FY1 here, and I came back as a junior registrar here. So there must be something right about Hastings, otherwise I wouldn't have come back this many times. But it's kind of, I've really found my feet here in Hastings. I've really found my medical family here in the emergency department, and that allows me to enjoy my job and have a good social life and do the career that I want to do.
Great. And what about a bad decision you've made in your life?
So I think a bad decision, apart from personal problems that I don't think I need to go into right this very second, a bad decision I think would probably not to have taken a break between SHO training and registrar training. So looking back, it's much easier to take that natural career break then and to go explore the world and go and do some other fun stuff outside of medicine to kind of just enhance your life, further your life experience and see the world before running straight into kind of run through training, because you kind of get on that treadmill and then you just kind of follow through, and then all of a sudden I'm here 13 years later and I feel like it was yesterday that was an FY1. So I think if I had any advice to anybody else, I'd say try and take a break somewhere in the middle of your training to go and do some other fun stuff.
Good advice, good advice. Now, what is your current speciality?
So emergency medicine.
Great. And what do you think is good about this speciality?
So I have a very limited attention span, and I would probably be diagnosed having ADHD, either that or an attention span of a 5-year-old, and it fits really nicely with that. So I like the fact that I come to work, see my patients, and I go home, and then when I come back the next day, it's not the same patients again, usually, only when we're on black. And I like the variety. So one day I could be delivering a baby, then I could be running a cardiac arrest team, or I could be allowing someone to die a natural, peaceful death. And then everything in between, trauma, sepsis, bumped knees in kids that fall over in playground, actually saving lives. So I think for me it's the variety that I absolutely love. And one thing that's great being a doctor in emergency medicine, because you get to ask them all sorts of questions and they tell you the answers. So how did that end up there? Well, doctor, it gives you a good day.
What advice would you give junior doctors who aspire to enter emergency medicine?
So the great thing about emergency medicine is the variety. So you can come into it from lots and lots of backgrounds. And what I really would do is encourage people to take their time through their training progress. So it honestly feels like yesterday that I was here as an FY1. The time has just gone so quickly. So if you add extra time by doing extra years, taking some time to spend an OOP-C or an OOP-T so that you can kind of add some more skills to your belt, and then do it less than full time if you can. So particularly for emergency medicine, you don't have to have a reason to do less than full time training now. And it allows you to create that balance between enjoying your job, having enthusiasm for your job, but also having your time away from work to rest and recuperate and fulfill other aspects of your life. So for me, I grow my own vegetables, I have chickens, I sew my own clothes, I bake, I make jams, I spend time with my children, and that allows me then to be full and enthused when I'm at work, because I'm not here 7 days a week every single day. So if you can do it less than full time, definitely the biggest piece of advice for me.
Great. Any warnings about anyone aspiring to be a doctor in the emergency department? So
the first few years are really hard. So the SHO year, when you have to work an SHO rota in the emergency department, it is hard going. Expect to work lots of weekends and lots of unsociable hours, and you'll be here at Christmas Day while your mates are at home relaxing. But it gets better. So registrar rota is always better. You do less weekends, you do less unsocial hours, and for my life as a consultant, it's delightful. So I do 3 days a week, I finish at 5 o'clock most days, and I work 1 in 6 weekends. So if you can put up with the hard few years at the beginning, you'll be rewarded with an excellent work-life balance later on.
Great. Any closing comments? Anything?
Just I have to tell you about my worst day. Well, worst day, best day. Depends on how you want to view it. So it was here when I was a registrar. We'd just finished dealing with a trauma call and a cardiac arrest call that I led for both. So it was an old man who'd had a cardiac arrest at the wheel and crashed his car with his wife in the front passenger seat. So he was the cardiac arrest, she was the trauma call. As I sat down in the main department writing my notes, the local registrar I was working with started acting very odd. Then he had a seizure. His blood sugar was 1.5, he was a known diabetic and hadn't had his lunch, so we put him into the next resus bay and was looking after him. Just putting the cannula in him to give him his 50% glucose, and the SHO that I was with came to me and said, "Oh, I've got some palpitations, I don't feel very well. And he was in SVT. So I had to put him in the bed next door, and I had to look after all of these 4 patients all at once. And that's a true story. That really happened here. And I just think it gives some description and some story to an actual day in the emergency department and all the different things that you deal with. That's it.
Thanks very much. Thanks for
No worries.
your advice.